Hi, my name's Jill and I've been a volunteer at Basingstoke Hospital for just over a year. I started just when the pandemic was hitting, and whilst the role I really want to do is an A&E volunteer, a role I've done before we moved to the area, that wasn't possible when the pandemic hit, and the only roles available were those that weren't on site. So I started at that time as a palliative care volunteer. This involved ringing a list of patients every week to check in on them, see if they needed any more help. When we were allowed to do on-site roles again, I started as a meet and greet volunteer, helping people find their way into the hospital and where they needed to go. This has also involved checking that they're wearing the right masks and trying to encourage social distancing. Always felt really well supported by the whole Basingstoke team.
When lockdown started, I found out about an opportunity to become a palliative care team volunteer within the Hampshire area. And I felt this was a very worthwhile thing to do, given the commitment all the NHS teams were showing to COVID-19, and I felt that perhaps I could do a little bit to help out. So I did my training online, and I was sent my list of patients to call on a regular basis. But I really have found the whole experience very rewarding and interesting. Over the past 10 weeks, I've got to know my patients very, very well. And we talk about their groceries and their medical needs, etc. But then we move on and talk about things that are just the normal parts of life. Family, friends, pets, gardens, and also all the courses many of them have been doing. I've got one lady in particular who loves painting. So we have a lovely conversation about Grayson Perry.
My name's Fleur and I'm one of the volunteers for Hampshire Hospitals. I got involved with volunteering during the pandemic because I really wanted to try and do something really small to help with what's going on at the moment. And my sister is a doctor and put me in touch with the volunteer team. And I have been helping support the hospice with their patients at home, which just means I ring them each week and make sure they've got everything they need practically, and also to make sure that they're not in too much pain and that they've got any worries, and I can flag that with the team back in the hospital. It has been really lovely to get to know these people, and I've really enjoyed speaking to them each week. I have really enjoyed being part of the team. The team at Hampshire Hospitals has been really supportive, and I've never worried about not knowing who to speak to if there's anything wrong. So it is something that started in these crazy world that we're living in, but I'm hoping will continue going forward for me.
Hello, my name's Sarah Anderson and I'm a volunteer at Basingstoke Hospital. I joined the volunteering team back in January, and the department that I was allocated to was the bereavement team. I had absolute confidence in the volunteering system that matches individuals to the particular roles in the hospital. And I have to say, I have thoroughly enjoyed my time there. I'd actually say it's been a complete and utter privilege, not only to see firsthand the people within the NHS and the sterling service that they do, but also to experience firsthand the bereaved relatives and to hopefully have made a tiny bit of difference. So the whole experience has been great. I've thoroughly enjoyed it. I absolutely want to continue volunteering for as long as the hospital will have me. My ultimate goal is to be based on a ward and to support within the ward, and I know that the experience that I've done so far will stand me in great stead for that, and I can see already offshoots of things that will happen, obviously post-pandemic and once we're out the other side. But I find it hard to put it into words, actually, what the last few months have meant to me as a person and what it's given to me as an individual, and hopefully giving a little bit back in return as well. So thank you.